Todd's Carpet and Tile Cleaning. Call or text 702-595-0488.
This study looked specifically at masked hypertension, and they found that, even if the blood pressures were normal in a relaxed environment, in a controlled environment, in the work situation, if they were working longer hours, there was a 70% higher risk for having masked hypertension.
The study looks at more than 3,000 office workers over a 5-year period. Participants wore devices to measure their blood pressure throughout the day. Researchers examined sustained hypertension, or blood pressure that is consistently high, as well as masked hypertension. They found people who worked more than 40 hours per week had an increased risk for both masked and sustained hypertension. The risk climbed even higher for people working more than 49 hours a week. Dr. Thomas says when we work long hours in an office, we spend a lot of time sitting, which is a risk factor for high blood pressure. The same goes for unhealthy sleep and snacking habits, which may also be associated with long work hours. Because symptoms of high blood pressure can be silent, Dr. Thomas says few people would suspect they have masked hypertension, especially if their numbers look good in the doctor's office.
I think the most important thing is for people who work long hours to understand that they are at risk for potentially having high blood pressure. And it's important that they bring it up to their doctor, so the doctors also can arrange for home blood pressure monitoring or 24-hour blood pressure monitoring, because these people, at least from the study, look like they have a much higher risk of having either sustained hypertension or masked hypertension.
Dr. Thomas says uncontrolled high blood pressure can lead to heart disease, stroke, and kidney disease. Lifestyle modifications such as a low-sodium diet, regular physical activity, lowering alcohol intake, not smoking, and keeping a healthy weight are the keys to keeping blood pressure at a safe level. Complete results of the study can be found in the medical journal Hypertension.